and globally. But at the same time, we also need to carefully evaluate each system to make sure that we take out what works and what doesn't work. There are some aspects of Ayurvedic medicine that can be dangerous, like, for example, some of their herbal therapies have heavy metals such as mercury, which have been accepted for thousands of years in India, but would not be appropriately used here in the United States. On the other hand, many other aspects of Ayurvedic medicine, such as nutrition, exercise and massage that I talked about, are very useful. So I think there are a two-pronged approach. You, the public, if you find it helps and is useful, then you need to lobby for it. Our responsibility is really to help you in the communications process, but also to do the research to demonstrate it's useful. And I think more important in future across healthcare everywhere, including the United States, is going to be economics research. We need to demonstrate that these interventions have long-term economic benefits, and we have to make choices now. There is a limited pie of money. We're going to have to carve up that pie. We're going to have to decide which gives us the big bang for the buck. And if something like Ayurvedic medicine can demonstrate over a period of 5 or 10 years of someone's lifespan that they're less sick than somebody who doesn't get it, then it's a no-brainer to me. We should be using it.
My question is for both of you. Pardon me. You emphasize the need for research and evidence. Opium is a terrible drug when it's converted into heroin. That has never barred research into the uses of opium, and many of our most effective pain relievers obviously are opium-based. There's anecdotal evidence, plenty of it, that marijuana is a great help in dealing with people who, their side effects from treatment for cancer. We used to have a program in this country that researched the uses of marijuana that was killed years ago. Are you aware of any move in the part of our government or medical establishment in this country or elsewhere to do some honest research as to whether or not marijuana helps or not?
I think there are plenty of evidence showing marijuana has active ingredients in taking care of many of the symptoms experienced by cancer patients, most prominently nausea and the poor appetite. In fact, there are lots of research done around the country, especially at the National Institute of Health, so that there is a prescription medicine using the active ingredient from marijuana. It's called Marinol, that can be prescribed. But of course, I have patients saying, this prescribed marijuana extract doesn't work as well as when I inhale it, which biologically can make sense because whatever you ingest goes through the liver metabolism and may be changed. When we inhale it, it goes from the lung to the brain directly. So, but as you said, there are political reasons and legal reasons and other things involved here. But for us, as researchers, we do find there are evidence-based suggesting this can be of a very good help to a lot of cancer patients.
I mean, you bring up a good point, which is it's a cultural aspect, and we have the same problems, you're absolutely right, with opiates, which we swing in opiates between basically under-treating patients' pain and over-treating with it, or so the politics swings. So sometimes we're in a situation where the legislators will actually make it very difficult for physicians to prescribe opiates. I had a patient in Canada where it's probably a little bit less strict, that the GP would refuse to prescribe opiates to a patient who had advanced cancer and said that the oncologist had to do it because he didn't want to take any responsibility, he didn't want to risk it. What this comes down to in the end, I think, is that common sense, but also dialogue and also balance. Of course opiates can be misused. Of course, like anything, you can drive a car too fast, you can drive a car inappropriately and have an accident and kill someone. Same with opiates, where you can addict people to that. But in the right context and used appropriately by trained people, then it's an extremely good drug. And I think there's also a place for cannabinoids as well. We've been using cannabinoids for nausea in the United Kingdom back in the 1970s. We have better drugs for it now. But there are new biological effects of cannabinoids that are being discovered all the time. An expert on this is actually our next president of the Society for Integrative Oncology, Donald Abrams, who's actually a professor of hematologic oncology at the University of San Francisco. And he's actually doing a lot of work and pushing forward with the politics to try and get this research done on cannabinoids. But they need to be used appropriately.
Hi, thank you for coming. I've been a medical writer for about 27 years now, and you've mentioned evidence-based medicine. My understanding is that for a lot of the herbs in particular, but some other alternative things, they've been practiced in Europe for years, and the evidence is there in Europe. Now, if we could get it here faster to our families and patients, why do we need to do, with all due respect, why do we need to do our own research? What's wrong with the Europeans? Thank you.
You bring up a very important point. I think we should treat herbs and botanicals with the respect they deserve, which is they are biologically active stuff. Because of that, they can cause effect and side effects and interaction with other things. In Europe, they have a history, a tradition of doing naturopathic practices, especially in the 1800s and so on. So they did accumulate a lot of data. But when we look at a lot of these data either from laboratory study or clinical study that were not properly controlled. So here, the bar is set very high. In order for you to use it with definitive evidence that it works and safe, you have to have multiple randomized controlled trials, which in practice it's very hard to do, especially when these herbs are widely available to people. Because how can you randomize someone to the control group taking placebo when they're saying, okay, you're using this herb, I would just want to go out in the street and buy it. So it is hard to do this kind of botanical research, but we are making an effort to overcome that barrier. At Sloan Kettering Cancer Center, we have many botanical agents undergoing clinical studies. But I agree with your point. We need to learn from other part of the world where we have accumulation of evidence. Another barrier is language, because a lot of the European literature is published in non-English. In Asia, because they have a tradition of using herbs and natural products, there are lots of publications there, but they're also in non-English literatures. So I think with internet and information technology, these can be overcome more easily. There are automatic translation software and so on that may be indexing these things. So I think it can happen.
Hello, my question is, in the early 80s or before, there was some significant research done here in Cleveland by a fellow doctor who was also a biomedical cell biologist. And it was on alpha-lipoic, the key ingredient to your cells that helps keep them normal. Have you seen any recent or been involved in any recent studies on alpha-lipoic and how it helps cancer patients fight chemotherapy, or prior to that helped to treat cancer?
Yes, there is currently a clinical trial done at MD Anderson Cancer Center testing whether alpha-lipoic acid can reduce chemotherapy-induced peripheral neuropathy. Some chemotherapy damage your nerves, you have numbness and pain, and they're doing a study testing that. So there are active research activity going on. But remember, a lot of these natural products in its current form, when you use them, the effect is mild and small. So you have to study a large number of patients to pick up that effect, and that makes it also difficult to study these things.
Yes, just to add to that, there are a lot of promising studies in the laboratory, but you really have to take it step by step beyond that. Sometimes I wish I were a veterinary doctor, because it seems that all mice cancers can be cured by something you do in the laboratory, but it doesn't hardly ever translate into human beings when you bring it to the clinic. So the laboratory preclinical science is very important as a foundation, but you really have to take the next steps to decide what doses to use and then take it into the randomized controlled trials with a good quality assured product.